Understanding dissociative identity disorder. Unraveling the mystery of split personality. Dissociative identity disorder, DID, commonly referred to as split personality, is a complex and often misunderstood mental health condition. It is characterized by the presence of two or more distinct identities within a single individual, each with its own unique patterns of thinking and behaving. These identities, known as alters, can take control of the person's consciousness and behavior at different times, leading to significant disruptions in their daily life. What is dissociative identity disorder? DID is more than just a quirky personality trait. It's a severe mental disorder often resulting from extreme trauma experienced in early childhood. This condition is marked by the presence of multiple identities or personality states, each with its own way of perceiving and interacting with the world. Individuals with DID might feel as if they have different people living inside their mind, each taking turns to control their actions and thoughts. These distinct identities can have their own names, ages, genders, and even different memories and behavioral patterns. They can also differ in their preferences, habits, and ways of interacting with others. For example, one identity might be calm and introverted, while another might be outgoing and aggressive. The transition between these identities, known as switching, can be sudden and is often triggered by stress or reminders of past trauma. Causes of dissociative identity disorder. The development of DID is typically linked to severe trauma, particularly during early childhood. This trauma can include physical, emotional, or sexual abuse, as well as neglect or exposure to violence. During these formative years, the child's mind may dissociate or split as a way to cope with overwhelming pain and fear. This dissociation creates distinct identities that hold different aspects of the traumatic experience, effectively compartmentalizing the trauma and making it more bearable. For many individuals, dissociation serves as a protective mechanism, allowing them to detach from the distressing reality and create alternative identities to handle the trauma. These identities can then emerge as distinct entities within the person's mind, each with its own way of dealing with the world. Symptoms and diagnosis. Identifying DID can be challenging due to the complexity of its symptoms and the overlap with other mental health disorders. Common symptoms include memory gaps, inability to recall important personal information or significant life events that goes beyond normal forgetfulness, feeling detached, experiencing a sense of detachment from oneself, as if observing one's actions from outside the body, switching identities, sudden changes in behavior, speech, and attitudes as different identities take control. Individuals with DID may also experience depression, anxiety, and self-harming behaviors. Diagnosis typically involves a thorough assessment by a mental health professional, who will look at the individual's history and symptoms to rule out other conditions such as schizophrenia or bipolar disorder. Living with DID. Managing DID can be incredibly challenging, as individuals must navigate the complexities of having multiple identities, each with its own needs and desires. Daily life can be disrupted by sudden shifts in behavior and memory gaps, making it difficult to maintain relationships and function effectively. Despite these challenges, many individuals with DID can lead fulfilling lives with the help of therapy and support. Treatment often involves psychotherapy, which aims to help the person understand and integrate their different identities into a single, cohesive self. Techniques such as cognitive behavioral therapy, CBT, and dialectical behavior therapy, DBT, can also be effective in helping individuals manage their symptoms and improve their quality of life. Misconceptions and stigma. DID is often sensationalized in the media, leading to widespread misconceptions and stigma. Movies and TV shows frequently portray it as a dramatic and frightening condition, which can perpetuate myths and misunderstandings. In reality, individuals with DID are not dangerous or unpredictable. They are people who have experienced profound trauma and are trying to navigate life with a complex mental health condition. It's crucial to approach the topic of DID with empathy and an open mind, recognizing that those affected deserve understanding and support rather than fear and judgment. Education and awareness are key to breaking down the stigma and fostering a more compassionate and inclusive society. How you can help. Supporting someone with DID involves understanding, patience, and compassion. If you or someone you know is struggling with DID, here are some ways to help. Be supportive. Offer a listening ear and a non-judgmental attitude. Acknowledge their experiences and validate their feelings. Encourage professional help. Advocate for seeking professional treatment from therapists who specialize in DID and trauma. Educate yourself and others. Learn about DID and share accurate information to help reduce stigma and foster understanding. By creating a supportive environment and promoting mental health awareness, we can help individuals with DID manage their condition and lead fulfilling lives. In summary, dissociative identity disorder is a profound and complex mental health condition that requires empathy, understanding, and comprehensive care. By learning more about DID and supporting those affected, we can contribute to a more informed and compassionate world.